The Quadratus Lumborum, or QL, is a deep-seated muscle of the lower back that connects the top portion of the pelvis to the bottom portion of the rib cage. This is one of the most commonly implicated muscles of the lower back when it comes to chronic lower back pain. So if you're the type of person that spends a lot of time seated or spending a lot of time under heavy loads with poor lower back and pelvis mechanics, then this is the right mobilization for you. So typically, if an athlete, especially a lifter, is going to lose lower back or pelvic position due to poor abdominal engagement, the muscles that connect the rib cage to the pelvis are going to end up taking the brunt of that load. So that's going to include the Quadratus Lumborum, but also players like the psoas and erector spinae group. So if this sounds like you, this is probably the right mobilization. However, you are going to need a larger diameter ball. You can use a trigger point ball, something that's approximately 4 to 5 inches in diameter, or you can use a softball for this mobilization as well. So first is you would never want to put this in the center of your lower back. The QL, again, from pelvis to rib cage here. Part of the action of this muscle is to help extend the lower back, but also on one side would help to hike the versa. In setting up this, I always instruct people to slowly ease their way into position. I would have the person start on their back without the ball underneath them, engage a little bit of a hip lift, and place this ball approximately right in between the rib cage and spine. And now on an initial pass, this is going to feel very unnatural to have this amount of extension going through the lower back. So I get people to first settle into it by letting their hips drop to the ground first to allow that full lumbar extension. And then once you can settle into this, if you can take a deep breath into the stomach and feel that pressure increase from the ball during the inhalation phase, then you are more than likely right on top of the QL. First step in this mobilization is to just let the hips settle and then focus on a couple different methods. One is you can go with a contract and relax paradigm, which is going to involve you thinking about hiking the butt cheek on the same side to the shoulder blade on the same side for a 2 to 3 second light contraction, followed by release and let the ball sink in a little bit deeper. Now you can do this in repeated cycles of contract, relax, until you feel the pain mechanism start to wind down here. However, if that seems to be not quite enough for you, what you can do is brace into the floor with your opposite leg, driving a little bit of force into the ground, which will direct most of the force going into your lower back right on top of that ball into your QL. Now what I would have the person do is to allow the knee on the same side to drop down toward the floor. Now what this is going to do, in keeping your rib cage stable, this allows the pelvis to rotate about the rib cage and creates a little bit of lumbar rotation in the process. Now if you find that dropping the knee to the floor, you can go straight to the floor, you may need a little bit more pressure on this. So go back to center, stabilize yourself into the floor with your arms, and then keeping the heels planted and relatively close together, try to create a windshield wiper motion through both knees dropping into the ground. Now this will add a pretty tremendous amount of pressure into the lower back, but it will also create the amount of pelvic rotation that you need to adequately dive into the QL on this one.